Good morning, friends. Welcome to our next learning session. Today, I am going to tell you something about a case which concerned with the reputation of medical profession. The concept in general public is that there is a nexus between the doctors to fleece money from the patients. Friends, doctors are not oblivious to this conception or misconception. When it comes to any other profession, let us say lawyers, the fees depends upon the complicacy of the case, difficulties involved, and the seniority of the lawyer. As you will see that the lawyer dictates the fees and not that the client has any say in fees. So there is no objection in their having these high fees. Similarly, about chartered accountants, depending upon their client and things, the fees is fixed by the chartered accountant. But in the case of doctors, this is not permitted. This is said to be against the medical ethics. The doctor's profession is considered a noble profession. Well, we are all happy that it is a noble profession. We serve the patient. We sometimes are able, with the blessings of the God, to save the life of the patient. But do everybody realize that doctor's profession is noble? Do they show the respect due to the doctor? Unfortunately, that is not true, and I have seen in my personal practice also that the patients do not give that regard to the doctor, which they say it is a noble profession and which is not equated with money. Friends, it is an incidence of mid-70s when I was telephoned and asked to come immediately to the hospital where a patient was undergoing operation under local anesthesia as fixed earlier. During the procedure, the patient started sweating profusely and confused and became unconscious. As I reached there, the only thing I knew about the patient in that emergency was the patient was a case of diabetes mellitus, hypothyroidism. He had some ear problem, he had hypertension, and this ear problem was to be operated under local anesthesia. So this was a straightforward case and there was no difficulty. I told the staff to start 5% dextrose solution infusion at a rapid rate. Within minutes, the patient became conscious. The theatre staff has also put up a cardiac monitor which was showing a deceptive picture. When I checked it, it was a wrong application of leads. Friends, I was wondering what this costly machine monitor will do when the people who are using the machine do not know about it. They do not know what the graph is showing and they do not know the interpretation of the graph, and the nurses do not know the use of defibrillator. I will tell you more about the case, but for my other colleagues and friends, who had requested me to use Hindi, I will briefly narrate the case. दोस्तों, ये mid-70s की बात है जब एक नर्सिंग होम से मुझे फ़ोन आया और कहा गया कि जल्दी आ जाओ, पेशेंट ऑपरेशन करते हुए बेहोश हो गया है। मैं वहाँ पहुँचा तो मुझे पता लगा कि ये पेशेंट एक हाई कमीशन से था, एक एम्बेसी से था। उसके कान में कोई प्रॉब्लम थी जिसके लिए उसका ऑपरेशन होना था। ऑपरेशन लोकल एनेस्थीसिया में होना था। तो इसका मतलब ये हुआ कि ये कोई बहुत बड़ी बात नहीं थी जिसके लिए बहुत ज़्यादा चिंता की जाती। पेशेंट ने भी एग्री कर लिया। उसको जो इंस्ट्रक्शन की दी गई उसने फॉलो की। उसको कहा गया कि सुबह कुछ खाना नहीं है, उसने नहीं खाया। उसको जो मेडिसिन दी जाती थी रेगुलर बेसिस पे वो दी गई और कहा कि इनको खा लो, उसने उनको खा लिया। जब उसको ऑपरेशन थिएटर में ऑपरेशन करने लगे तो वो अब पूरी तरह से पसीने में भर गया और डॉक्टर्स ने देखा कि वो बेहोश हो गया है, इसलिए मुझे बुलाया गया। मैंने आते ही 5% ग्लूकोज का सोल्यूशन की ड्रिप शुरू की और काफ़ी फास्ट ड्रिप दी, अबाउट 4-5 ml पर मिनट, और विद इन फ्यू मिनट्स द पेशेंट रिगेन्ड हिज कॉन्शियसनेस। जस्ट 5-6 मिनटों में ही पेशेंट ने रिस्पॉन्ड करना शुरू कर दिया और पेशेंट कॉन्शियस हो गया। तो वह क्या हुआ ये सब कुछ? फ्रेंड्स, when I reached the nursing home, I found this patient who was moderately built and nourished. He was from a high commission and he was taken as a good paying case. A monitor was put, but I really wondered that what this monitor will do, what the defibrillator will do when the doctors attending on him did not know how to use this, when the doctors did not know how to interpret the ECG which was being monitored. And when I checked, I found that leads were wrongly placed. So if the doctors do not know the wrong leads, the graph would be also defective, deceptive, and the patient will be considered the patient is having some sort of heart problem. So as I started 5% glucose at a fast rate, within 3-4 minutes the patient became conscious and started responding. Anyhow, the operation was completed and patient was brought back. But all this episode of hypoglycemia, let me tell you what had happened is that patient's glucose had fallen in the blood. His blood sugar had fallen, and this condition is called hypoglycemia. Hypo means low or less, and glycemia means sugar. So low sugar or less sugar is the condition which is called hypoglycemia. So this patient had developed hypoglycemia. But why? Because he has not eaten anything this morning, but he was given the medicines which lower the blood sugar. This is called sulfonylureas, and the common drug at that time was Dionyl, which is glibenclamide, 5 milligram tablet. This remains in your blood for 24 hours and is effective for 24 hours. So once you have given the drug, you have to give the patient something to eat so that his own blood sugar does not become too low. But that point was missed by the attending staff due to their insufficient knowledge. But question is that did any physician see the patient? That is where the question was coming, which I narrated in the beginning, that this was not done. Why? Why it was not done? It was just to cut the cost of the operation, because the patient has been given a package, and in that package they wanted to spend minimum money on the patient care so that the nursing home gets the profit. For a number of reasons, I am not blaming the nursing home, but that was the thing, and that will be done everywhere in every profession. Every shopkeeper, they will cut costs from somewhere or other way to entice the client. And here also, in medical practice also, the patient was given a package and the cost cutting was done at the cost of a physician. The physician was not shown the patient before operation. What is called pre-operative checkup by the physician was not done. Now, this physician was to tell that do not take the hypoglycemic drugs if you are fasting, and patient was to tell the physician was to tell them what to do in the operation theater, but they made a shortcut and paid the price. दोस्तों, डॉक्टर फिजिशियन के ना बुलाने के कारण और फिजिशियन को केस ना दिखाने के कारण पेशेंट को ठीक इंस्ट्रक्शंस नहीं मिल पाई और पेशेंट को वो दवाइयाँ दी गई जिनसे ब्लड शुगर कम होती है जो वो नॉर्मली ले रहा था, पर नॉर्मली वो खाना भी खा रहा था, और आज इस ऑपरेशन के टाइम पर उसको कहा गया कि उसने खाना कुछ नहीं पर गोलियां दे दी गई। तो उन गोलियों के असर से उसकी ब्लड शुगर आस्ता आस्ता कम होती होती इतनी कम हो गई कि वो अनकॉन्शियस हो गया। जब मैंने उसको ग्लूकोज दिया तो उसकी कॉन्शियसनेस रिटर्न हो गई। सो ये एक इतनी इम्पॉर्टेंट बात है जो लोग नहीं समझते। बात आ जाती है कि डॉक्टर को पैसे देने को कोई तैयार नहीं होता, डॉक्टर को फीस की ज़रूरत नहीं होती, डॉक्टर को तो सरवाइव नहीं करना होता, इसलिए ऐसे काम किए जाते हैं। सो दोस्तों, अगर आप चाहते हैं कि डॉक्टर आपको अच्छा अटेंशन दे, अच्छी तरह से देखे, डॉक्टर लालची भी ना हो, तो आप डॉक्टर को कहें कि प्लीज़ अपनी फ़ीस लीजिए, बजाय ऐसा ना करें कि आप उसको फ़ीस, एक बार अगर डॉक्टर ने कह दिया कि कोई बात नहीं फ़ीस मैं नहीं लेता, तो आप बड़े खुश हैं कि डॉक्टर ने मेरे से फ़ीस नहीं ली। यू शुड, आपको इंसिस्ट करना चाहिए, आपको जोर देना चाहिए कि नहीं चाहिए, आप हमारे लिए इतना कर रहे हैं तो ये फ़ीस हम आपको ज़रूर देना चाहते हैं। सो फ्रेंड्स, नॉट दैट डॉक्टर्स आर ग्रीडी, बट द पेशेंट्स आर मेकिंग देम हार्ड दिस वे। Why? I've seen a large number of people who are very well placed in society and very well to do. In parties, they will be using silverware and there will be competition in the number of dishes being provided, but they would not like to pay the fees to the doctor. And then why do they expect from the doctor that he should be doing good to them without charging any money? And if he charges money, it is the doctor is greedy. No, this is just an injustice to the doctors, but nobody has yet looked into this thing. We as doctors, we do discuss with each other that this is the flaw of the society, but nobody from the government or from the doctor side has done anything for this thing. Even DMC will go against the doctors if the doctors charge more than a limited amount of money. If doctor saves the life of a person, can there be any fees for that? How much fees that can be? Can anybody decide? In the hour of need, even a glass of water is worth of millions, but people do not realize this thing. So when I did this thing, the patient's heart also suffered some damage, and this damage is called subendocardial infarction. I told the patient's wife, and she was worried. As a natural consequence, she asked for a second opinion, and another doctor was called who was even senior to me at that time, and he was looking after many embassies. He came and he said, no, there is no infarction. But when I showed him the ECGs and gave the reason, he agreed with me. He said, yes, you treat him like a heart attack. The patient was kept in the hospital for 4 days and then discharged. So the patient who has come as an outpatient went out as spending a good amount of money to the hospital. Now, friends, this is the type of situation where money saving has no value. That patient remained in the hospital and then asked me to come to his residence and look after him. He remained in India for 6 years after that, and I was his personal physician, I was his family physician, as well as I was the physician for all other offices of that country and the friends of this person who had come from that country. I used to be called and I used to give them my care. So friends, this is a very interesting case which went into hypoglycemia due to the medicines. दोस्तों ये एक ऐसा केस था जिसमें ब्लड शुगर लो हो गई थी, इतनी लो हो गई थी कि जिसमें पेशेंट अनकॉन्शियस हो गया और पेशेंट के लिए प्रॉब्लम पैदा हो गई। पर ये सब दवाइयों का खेल था, दवाइयाँ ना दी जाती तो उस पेशेंट को ये प्रॉब्लम नहीं होती। तो दोस्तों अगली बार हम एक नया केस लेके चलेंगे, उसके बारे में बात करेंगे। फ्रेंड्स, वी विल टेक नेक्स्ट टाइम अनदर इंटरेस्टिंग केस एंड डिस्कस विद यू द डिफिकल्टीज विच वी फेस and how we learn and become wiser for the future. Thank you very much. Now friends, I want to show you few diagrams and see this first diagram. Look at this diagram. Now if you can see, look at this. This is the right ventricle, left ventricle are marked LV and RV, and this is pinkish portion, light pinkish portion, thickness I am marked as the myocardium. This is the full thickness of myocardium from the left ventricle to the outside. Now if you see from here to go like this, this is marked here. From this all area is myocardium. This all area is myocardium. But this bluish area from right left ventricular cavity to the end, this portion is called subendocardium, and this is the epicardium. So the entire area between this is the myocardium, and this blue area is the dead area, that is the infarct. Dead heart muscle is called infarct. Remember please, dead heart muscle is called infarct. But see this blue area here, little blue area, this is the endocardium, and this is the myocardium, and this is blue area is the infarct. But this area is normal. From blue line to this end line, this area is normal. So a part of this heart muscle has become dead here, and that is why it is called subendocardial infarction, because this is the endocardium and this portion is coming under the endocardium, so it is called subendocardial infarct. So this is less dangerous, and our patient had this type of situation. See, I show you another diagram here. This is one complex of ECG. See, this is the baseline. See, this is the P wave. Then again baseline. Then it is going down. It is the Q wave. Then it is coming upcoming portion of Q wave, and then this is the R wave right up to this place. Then the downstroke of the R wave, and then from here baseline it becomes the S wave, and then S wave coming back, upcoming portion of the S wave, and S wave where it joins with the T point, it is called J point. And you see this, this is the baseline, this is the baseline, but this line is much above the baseline. See this, how much above the baseline is this line? See this. Now my scale is at the baseline, and see this line is above the baseline. How much above the baseline is this line? Now look at this. This is more clear. From here, this is the all raised ST segment. This is the ST segment, and this is raised so much above. This is the type of infarction which is called acute myocardial infarction or total thickness myocardial infarction. Here the whole myocardium has become dead, as I showed you in the other diagram, like this here, blue portion, see this blue portion, the entire myocardium has become dead. If ECG is taken from this portion, that is what I have tried to show you, it will look like this, that this S wave and ST segment is much above the baseline, like this is the baseline, and this is much above the baseline. So friends, this is what is called subendocardial infarction. Our patient suffered this subendocardial infarction, and but we were lucky to save him and discharge him from the hospital. Thank you very much.